Tēnā tātou katoa, good evening. Many of us have noticed more friends, family, workmates struck down by COVID lately. And now there's evidence the virus is storming back, with 6,000 cases reported today.
It's the most we've seen on a single day in more than 3 months. And a COVID-19 expert claims a third wave could have been avoided if the government had kept the protection framework and secured more effective vaccines. Lucy Thompson has more.
A new wave of COVID-19 just in time for summer. 6,000 cases were reported today, over 1,200 more than the same time last week.
We're seeing cases doubling every sort of 3 to 4 weeks at the moment.
Today's numbers bring the 7-day rolling average to 4,041. But Auckland University's David Welch maintains we could see as many as 11,000 cases a day just in time for Christmas. He says that's partly down to the government getting rid of the COVID-19 protection framework.
Have been useful to maintain something to, like, sort of the fire warning system, low danger, medium danger, high danger, and give some appropriate guidance.
Epidemiologist Professor Michael Baker says mask use should be more widely encouraged.
I would like to see the existing mask mandates that we have for healthcare and aged care extended to public transport, because people can spend a lot of time in a very enclosed bus or train that often has very poor ventilation.
But are people worried?
No. I can, because we're fully vaccinated.
You don't have to wear masks, or nobody asks for your vaccination, so I kind of forgot it.
Of today's cases, 26% are reinfections.
There's kind of a handful of variants, and they all share a similar mutation in the spike protein, or a similar number of mutations in the spike protein that help the virus evade immunity. So we're seeing more and more people getting infected for the second time, unfortunate few probably even for the third time.
He says more modern, more effective vaccines are out there, but the government and authorities have been too slow to act.
There are boosters out there that are in use in other parts of the world that are more targeted at the current variants, that targeted at BA4, BA5 and subvariants that we have here. But unfortunately it's not available here, and there's no indication that it's going to be available this year.
The government refutes those claims, but all indications are we're in for a COVID Christmas. Lucy Thompson, Newshub.